Hi everyone, my name is Jillian Warwick and I'm the nutritional therapy practitioner at Back to Normal Physical Therapy in downtown St. Pete. And today I'm going to share with you some information about IBS or Irritable Bowel Syndrome. It's IBS Awareness Month this month, which is April. And so I thought it'd be helpful if you aren't aware already of some of the facts about IBS. It might be nice to cover some of the information around what irritable bowel syndrome is, what symptoms you might experience in a flare-up, some of those triggers and causes of those symptoms, and also how you could be diagnosed with that and the different types of IBS. So to start off, irritable bowel syndrome is a very common disorder that really affects digestion primarily, especially interfering with the normal function of the large intestine. IBS is not a single disease, but it's really a symptom cluster resulting from diverse pathologies. And that doesn't mean that each person can't struggle with different symptoms and then also have their own unique triggers. So the symptoms of IBS can range from bloating and gas, cramping and abdominal pain, diarrhea and constipation, or a combination of those two, and changes in the stool appearance or consistency. So you might have looser stools or even mucus in the stools. So there are a lot of different types of reasons you might be experiencing IBS, ranging from food intolerances to stress even. So experts believe that factors that continue to contribute to the development can be things like the alterations in the gut microbiome, intestinal permeability, which is also considered to be leaky gut, impaired gut immune function, problems with motility, which is, through the intestinal tract, gut-brain interactions, and psychological disturbances or emotional traumas. Some underlying causes could be things like eating a highly processed, low-fiber diet for some people, food allergies or intolerances or sensitivities even, because that can cause things like leaky gut, stress, which also can cause leaky gut, inflammation and free radical damage that will also damage the intestines, nutritional deficiencies. Leaky gut itself is something that I'm like to educate people on how to prevent that because it can lead to a variety of problems in health. Use of certain medications, poor lifestyle choices such as drug use, smoking, high caffeine, and high alcohol consumption. SIBO, which is small intestinal bacterial overgrowth, or infections of the digestive system, and even hormonal changes like menopause or shifts during the menstrual cycle. And lastly, dehydration can be a very big trigger for IBS. So all of these things considered, you have to know some of the criteria used for diagnosing IBS if you want to possibly see a doctor about these symptoms. So the onset of symptoms has to be at least 6 months before the diagnosis will be made. Recurring abdominal pain or discomfort for more than 3 days per month during the previous 3 months. Having at least 2 of the following features: improvement of symptoms following a bowel movement, or association with a change in stool frequency, or association with a change in stool form. There are several types of IBS that are categorized according to the predominant symptoms that are experienced. So that would be something like IBS-D, which is predominantly diarrhea, IBS-C, which is predominantly constipation, and then you could have a mix of the two in which you have both occurring throughout the issue. IBS treatment is really very tailored to the individual's needs depending on the symptom or the underlying cause. So food intolerances, chronic stress, low motility, depending on what you're experiencing. Treatment usually involves dietary changes and sometimes the use of medication or even emotional counseling and some sort of stress relief therapy. If emotional and psychological stress is believed to be a major factor, then it's good to implement some stress relieving activities like biofeedback training, relaxation, meditation, mindfulness, psychotherapy, talk therapy. Those all can be great for lifestyle changes, and they're typically the first line of treatment is that lifestyle change and the diet change. And then if that's not helpful enough, doctors can sometimes prescribe medications, but that should kind of be the last resort. At least if you ask me as a holistic practitioner using nutrition and supplementation and lifestyle, those are my primary ways of addressing anyone's imbalances in their body. And I hope this was information that helps you or a family or friend. Feel free to share that, and keep an eye out for my next little video in the in the IBS Awareness series, which will be more about the food list, the diet plan, and how you can avoid the right foods and include the right foods to help with IBS. Again, I hope this was helpful, and see you next time.